joining us on the program now is a good friend of the Institute's, and actually her and her company are being recognized at next week's IHC Forum for a Leading Industry Innovator Award. I've got joining us Cathy Kenworthy, President and CEO of Interactive Health. Cathy, good morning.
Good morning. How are you?
I'm doing great. Good to talk to you.
You as well.
I look forward to seeing you next week.
We're looking forward to being there. We'll have a lot of our team there in full force, so it's going to be a great event, I know.
Yeah. Cathy, give our audience a little background around Interactive Health, if you would, please.
Sure. So Interactive Health is been dedicated to the mission of helping employers create an environment where their employees can be healthier for coming up on 25 years. So we're known for our ability to be very rigorous in terms of the work we do, executing through our own people, having a very broad reach in terms of the comprehensiveness of our services, and all of this has allowed us to gather a tremendous amount of data to be increasingly predictive about the impact of preventive care, which we know to be very significant, and as you were just talking about with regard to health management, how that fits into a very fast-paced, evolving world of health plan design. So it's we have a lot of passion for the work that we do and are very appreciative of the broad client base and membership that we work with.
Cathy, as an industry innovator, talk a bit about what drives innovation, not just for Interactive Health, but also for you personally.
Sure. Well, I personally have an almost unlimited appetite and curiosity for the topic of business problems and business opportunities. And when you think about healthcare in America, it is our, I think, fair to say, kind of top economic issue in the country in terms of the rising pace. And you were just talking about the increasing presence of millennials in the workforce, and of course, the incidence of diabetes and obesity is occurring at a younger and younger age. So these are very critical, tough issues around innovation. And I personally like to think of innovation not as radical kind of capital I wholesale changes, but I think of some of the best innovation being innovation that comes from a very studied understanding of process and need, and being able to be very thoughtful in the small actions that lead to big changes with regard to innovation. Years ago, we would have all said, well, gosh, we have our cell phones, they flip, they've got big buttons that you can see when you push, right? And everyone was happy with those. Nobody dreamed of taking a picture with their phone, and yet today most of us can't live without our smartphones, unfortunately. And that didn't actually happen as one big, broad sweep from one to another. There was a lot of careful study that went into people's habits and how to craft and create something that has, in the end, made a very transformative impact to many of our lives. So I'm very curious and kind of insatiable about the topic of innovation.
So what are some of the recent innovations at Interactive Health that you're most excited about right now?
Yeah, it's a good time to be at Interactive Health. We have a lot cooking. So we're really working on two stripes, if you will, with regard to innovation. So we're working on the range of our services with regard to being able to help improve the health of individuals. And we're working on the range of our channels through which we interact with the individuals that we work with. So both the scope of services and the scope of channels. But all of it's anchored in one starting point, which is being able to be very results-driven. We're very proud of the fact that we're able to prove to our clients the impact of the work that we do. And so while we're appreciative of that impact, our goal is always to do better tomorrow than we did today and better than we did the day before. So that's always the measuring stick, if you will, as we think about innovation. So to the heart of your question around services, we've been very well known for our ability through our own people to conduct very rigorous health evaluations and health screenings of lots of flavors and fashion. We're adding to that increasingly an understanding of what the emotional context is for people to make those changes. We've always had a lot of interest in understanding through our own health assessment tools, factors indicating depression, anxiety, stress, things of that sort. And so we're using, again, that data, but a lot of original thinking around how to address that. And one example I'd like to share is a really powerful campaign that the Northeast Business Group on Health and NAMI and a number of mental health organizations have sponsored called I Will Listen. And it's a campaign that I think you can instantly appreciate has a very simple set of words that convey some really powerful ideas around how to help people think about their emotional health, their mental health. We all have opportunities to think about that, and there are people who have particular need to think about their mental health and need resource and help. And so I Will Listen is a campaign we undertook recently for Interactive Health as an employer group. We did that a couple of weeks ago internally in our own organization to understand the power of the campaign and what it can mean for our people. It's something we're very much looking forward to talking to our clients about as well. We had a very successful initial experience with it. So that's one example. There's a ton of other things that we're doing in the space of the scope of services and how to really address the full set of needs that individuals need when they think about their health. With regard to channels and the scope of the channels, we are very appreciative of the fact that we work face-to-face, through the telephone, on the web, with mobile applications, how we integrate all those channels so that we can get to people in a variety of points of contact, whereas old school is believing that paper still makes sense, and so we send detailed packets of information to individuals' homes, but we also have a lot of cool work that we're doing with regard to mobile development and how to really integrate all of those points of contact. And we think we've got a really unique position in terms of the scope of the channels that we are able to work with individuals in.
There's a lot of clutter out in the marketplace, is there not, Cathy? And that I think some of the things you're talking about now are the things that make Interactive Health stand out from the many other wellness providers. What are some of the other things that make Interactive Health stand out? Yeah,
somebody referred to it the other day as kind of a gold rush, and we appreciate for sure that, as I mentioned at the outset, this is a really high priority economic topic for the country as a whole, and certainly for every employer group. So I appreciate the gold rush mentality, but I think for us the differentiation always comes back to being very rigorous about. Sometimes I talk about I get the privilege of doing something that is equal parts altruism and capitalism. And we do good work that helps people, but we also do good work that can be articulated as a value proposition. And our commitment to being able to use the data, we have well over 20 years worth of data. We've worked with millions of individuals. And so increasingly, we're doing things like being able to identify in a prospective employer population the mix of relevant demographic variables around gender, age, geography, create a like grouping based on our book of business, including industry and other factors, and then being able to actually be predictive around what the expected impact would be for various kinds of program design. And I think that can be really powerful, not on its own as, quote unquote, the answer, but certainly in terms of improving the odds of success that, if an employer group has a lot of older individuals or individuals in particular geographies, we can know with a lot of certainty that might be a more difficult population to move, and a program design that's more intensive with regard to the degree of coaching, with regard to the degree of testing, might be very beneficial for that population compared to another. And so, we love playing in that space between art and science and helping people understand what's possible for a given population.
Cathy, what's ahead for health management and wellness? What do you see as the future for wellness ahead?
So I think this is a long-term topic. I've been studying quite a bit about the Cadillac tax, and I know there's a lot of controversy right now about whether the Cadillac tax will continue or not. And when you really think about it, whether the tax continues or not, it's meant to be a deterrent. It's meant to say, let us not continue to have the same scenario where the pace of medical inflation is so much higher than the pace of general inflation. I read a statistic recently that deductibles for employees have risen 67% since 2010, 7 times faster than wages, which I just found astonishing, right? Those are huge numbers. And, where the Cadillac tax and concepts like that really have a lot of bite is that, an individual employer group might look at 2018 and say, okay, I'm not offering plans to individuals or employers that are, going to pierce the 10,000 or the 25,000 break points. But the way it's structured, the Cadillac tax would be applied to those parameters based on medical inflation, and the percentage of employers that by the year 2020, 2022, 2000 goes up dramatically. I mean, like 50% of employers would be in the mix with regard to Cadillac tax based only on the plan designs that they're offering today, left to the cost of medical inflation. It impacts self-insured employers, fully insured employers, across the board. And as to your prior conversation, people might say, okay, well, I'll take my employees to private exchange. You all are, I'm sure, in on the joke that when somebody goes to private exchange, their population is going to be rated based on the health of that population. It's not commingled with others. So if you bring an unhealthy population into a private exchange, you're going to continue to face, or your employees are going to continue to face these same very, very challenging difficulties with regard to the economics of it, even the healthy employees that are in the mix with an unhealthy group. So there's a lot of economic factors that say being determined that the secrets to predictive modeling, the secrets to preventive care, the secrets to health management actually don't need to be secret. This is basic science. It's well understood science. What we do in our craft, and many other good providers in the industry do as well, is apply with execution and intensive effort the real thoughtful underpinnings of helping individuals who are suffering, particularly from chronic conditions, rethink choices in their life around nutrition, around activity. We've got technologies sort of exploding around us that give us lots of options and tools in terms of how to do that. So I think the one other thing I would say about the future for the industry is I think we've got to take some of the noise out. You mentioned before there's a lot of clutter. There's people saying it works. There's people saying it doesn't work. I think those of us who are in the industry know that well-designed programs absolutely can make tremendous impact. And I think we need to articulate with a clearer voice what those best practices are all about. There's accreditation agencies like the NCQA, HERO, not clearly in the business of accreditation, but certainly being a leader with regard to what best practices look like. The work of the Institute here is very important to that. There's national business groups on health, the Business Roundtable. All of these carriers who are seeing tremendous impact from the work around preventive care, I think those voices need to be stronger and more united around the good work that's being done in preventive care.
Cathy, I really appreciate you, your time this morning. It's always interesting to have you on, and I thank you so much for that. And to our audience there, you can visit with the Interactive Health team at IHC Forum West next week. Plus, they will be participating in 2 of our key workshops. So, Cathy, you have a great weekend, and we'll see your team and you next week at IHC Forum West.
Looking forward to it. Thanks so much, you guys. Have a great weekend.
Thanks, Cathy. Take care.
Take care.